going.
Hi, my name is John Johnson. This is my friend Sarah. I'm with the All About Health Network, and we're going to talk today about anatomy. The ideas that I'm going to give you today have a lot to do with Thomas Meyer's work called myofascial trains, and it's the whole idea of our anatomy kind of can be likened to the idea of a train, a set of individual trains connected. So when we do the body work that we're going to be doing with the different massagers, the idea is that the whole body's connected. So if you've got an issue up in your neck and shoulders, you really need to be dealing with your whole body. So I'm going to start with the feet and take us through the whole body. So the feet, you want to just stand with your hips apart, your feet underneath your hips. So normal stance, you want to just move over a little bit so you can get a straight on. The feet, normally you want to have your feet straight forward like your feet. Sarah's got nice feet, but the idea that happens with most of us with shoes is that if you look at a shoe, pretty much it squeezes the toes. So we lose a lot of space in between our toes, and I'll be talking about that a little bit. We have some products that will help put space in between the toes. If you lift your toes up, we have arches in our feet. Lifting your toes, you see how she can spread those toes? Most of you can't do that. Put the toes back down again. When you lift your toes like that, you're actually engaging the arches of the feet. There are 3 arches in the feet, and there's a middle arch, an outer arch, and an inner arch. We'll be working with the feet. So the feet and the bottoms of the feet are really important to your health. They're the furthest thing from your heart, so they're the first things to go in your body as far as circulation. If you look at people with diabetes or circulatory issues, feet are the first thing to go. Usually they can't even feel the bottom of their feet. They can have sores on the bottom of their feet, they don't even know it. So getting good foot massage, some kind of work on the feet on a regular basis is really critical to your health. So then we move up the body. We'll be talking about trigger points a certain amount, because a lot of times when you have a problem in one area, there are trigger points in another part of the body that are causing that problem. So the feet are connected to the lower leg. The lower leg, you've got the calves on the back, and then a couple of muscles that are along the bone here. You've got a bone up the front here, the tibia. And there are muscles on both sides of that. And the calf is the big muscle in the back. There's 2 muscles actually there. And then you move into the knees. Can you just go sideways for a second?
Sure, this way?
Yes. So if you look at Sarah's posture, you can see that she doesn't lock her knees. There's a nice little flow here. A lot of us, when we stand, we lock our knees, and that kind of cuts us off from the energy of the earth, and it causes major anatomical issues. Now if you look, I haven't even asked her to do anything here. There's a plumb line pretty much from the ears all the way down to the ankle here. And ideal posture is pretty much straight through. It's a straight line up and down. Most of us don't have that. But there are lines. It's not a straight line like this. There are curves. The spine has a curve. The lower back has a curve. The legs have a curve. So this is your ideal situation. And that only comes from daily practices like yoga and or regular massages. Let's stop the video now and